Welcome to the module Infection Control in the Management of Continence Care. It's important in all aspects of care to think about infection control when looking after the residents within your care home. Protecting your residents from infection is an important part of high-quality care and should be an essential part of toileting and continence regimes for your residents.
Let's start by looking at why infection control is so important within a care home.
Many infections have the potential to spread in a care home due to the sharing of eating and living accommodation and the fact that residents may have an increased susceptibility to infection due to various factors: age, immune status, poor nutrition, underlying medical conditions, diabetes, heart problems, antibiotic therapy, incontinence, urinary catheters, gastric feeding tubes, breaks in the skin. Infection control has become even more prevalent due to the increasing number of organisms that have become resistant to treatment. Healthcare-associated infections may worsen underlying medical conditions and lead to avoidable admission to hospital and may occasionally be life-threatening. MRSA, C. diff, E. coli. What do we mean by infection control? Did you know there are 10 elements of standard infection control precautions? Hand hygiene, PPE, respiratory hygiene, management of blood and body fluid spillage, occupational exposure management, control of the environment, management of care equipment, providing care in the most appropriate place, management of laundry and linen, safe management of waste. Many of these 10 elements play a role in the management of continence care for your residents within your care home.
So, what could the impact be?
What could the impact be in your care home if infection control standards and continence are poorly managed? The impact is likely to lead to a rise in infections among both residents and staff, resulting in residents becoming very unwell, and for those with underlying health conditions, this could prove to be very serious and can even result in death. This could also lead to increased staff sickness with likely staff shortages. Poorly managed continence will not only increase infection risks, it also can increase unpleasant odours within your care home. Existing residents and their relatives may become concerned about standards within your care home and may choose to move their relatives to a different care home as a result. CQC inspections are likely to deliver poor findings, which will damage the home's reputation and is likely to discourage any interest from potential new residents. High-quality management of infection control ensures the home remains a safe environment for your residents. Residents remain cared for, staff health and well-being is protected, and the home will establish a positive reputation, increasing effective care of residents, occupancy and assessments by CQC. We need to remember that prevention of infection is everyone's responsibility.
So, what are the causes of infection and what are the solutions?
For an infection to occur, several things must happen, known as the chain of infection. To illustrate this, here is an example along with how everyday infection control could help break these links to provide protection. 1. You have a resident with C. diff infection in your home. C. diff is the infectious agent. 2. Spores and bacteria from the resident's faeces will be transferred into the surrounding environment, and with every bowel movement, their skin, their hands, toilets, commodes, clothing, bedding, food trays and furniture are all places where C. diff can live, grow and multiply. This is known as the reservoir. 3. Think about the infection agent C. diff as germs sitting on top of a used commode, the reservoir. A healthcare professional comes along and touches the commode, and some of the germs move on to their hands. Their hands have now become the third link in the chain. This is known as the portal of exit, essentially the mode of escape. 4. Another resident calls out for help, having fallen. The healthcare worker runs to help, touching this resident in order to assist them. This is the point of transfer known as the mode of transmission. 5. The resident on the floor is diabetic and has fallen due to low blood sugars. The healthcare worker with the contaminated hands gives an oral supplement. both the carer and resident's hands are contaminated and have touched the oral supplement. This has now become the portal of entry into the resident. 6. The already vulnerable resident has now ingested the germs into their gut and developed symptoms of C. diff. The resident has now become the susceptible host, completing the chain of infection. The good news is that by following some simple, straightforward measures that will be outlined in your infection control guideline, we can break the chain of infection. If the healthcare worker had been wearing gloves and an apron when touching the commode, followed by the quick removal of their PPE, then washing and gelling their hands, and again washing their hands before touching the oral supplement, this would have been enough to break the chain of infection for this scenario.
Let's talk about the importance of hand hygiene.
Poor hand hygiene is one of the most common causes of the spread of bacteria and infections. Good hand hygiene is one of the most important factors in preventing the spread of bacteria and infection. So what can we do? Hands must be decontaminated immediately before and after every episode of direct patient contact. In your home, it's important to have a structured approach to hand hygiene to prevent cross-infection. It's important to remember that using hand sanitizing gels should be performed when the hands are visibly clean and dry, while hand washing should be performed if the hands are visibly soiled or wet. After washing, the hands should be disinfected, since washing with soap and water removes dirt, but this does not kill microorganisms. To reduce the risk of cross-infection, we need to be thinking about when we should decontaminate our hands. For example, before and after carrying out any toileting regimes or pad changes. Immediately before giving personal care to a resident. Between giving care to different residents. After bed making. Before putting on gloves. After removing protective clothing such as gloves and aprons. Or whenever hands are visibly dirty. So when should we follow hand hygiene protocols in the care home? After any activity which may result in contamination of the hands and after any situation that involves direct contact with a resident. For example, bathing, assisting to move a resident, toileting, after handling blood or other body fluids, before and after emptying urine drainage bags, after handling laundry and waste. Effective hand washing techniques should be followed to ensure that you are removing all the potentially harmful bacteria from your hands. Due to the fight against COVID-19, best practice hand washing techniques have never been so advertised and readily available on many websites. Some of the main ones we would recommend for you to view are WHO, NICE, NHS, NMC, and the RCN.
Let's talk about if personal protective equipment, also known as PPE, is important.
The use of personal protective equipment, PPE, is essential for health and safety and offers protection both to residents and carers. PPE includes gloves, aprons, face and eye protection, but can also include gowns and foot covers. It's extremely important that before using PPE you are familiar with it, how and why you use it, and how to remove it safely and effectively to avoid cross-contamination. When using gloves, you need to remember they are single-use items and should be correctly disposed of after every use. Gloves should be used when assisting a resident with toileting and/or pad changes due to the risk of exposure from bodily fluids. Gloves should be applied before you carry out the procedure, being mindful you are not doing anything else like collecting equipment or opening doors before patient contact. You should remove the gloves as soon as you have completed a care intervention or if your gloves become soiled at any point. You should not wash your gloves or use alcohol products between procedures, and you must always change them when going from resident to resident. You do not need to wear more than one pair of gloves at a time. Aprons are also single-use items and must always be worn when in close contact with your residents and when using all materials or equipment that pose a risk of contamination with bodily fluids. Fluid-repellent gowns must be worn when there is an extensive risk of splashing of bodily fluids onto the skin or clothing of the healthcare professional. Aprons should only be worn for one procedure, then correctly disposed of. Putting on your PPE and removing your PPE should always be carried out following a sequence which should be within your infection control guidelines. It is essential that each of these sequences are carried out step by step each time a healthcare professional uses PPE. This will help to minimise the risk of cross or self-contamination. PPE should always be disposed of into clinical waste bins.
Let's talk about the management of blood and body fluid spillage.
The care home environment should be visibly clean, free from dust and soilage for all residents, their visitors and staff. Regular and efficient cleaning is necessary to maintain the appearance and function of the premises. It's also required to control the microbial population and to prevent the transfer of potentially infectious material. In a care home, spills and accidents with bodily fluids may be inevitable and difficult to manage. Residents may frequently remove their products or pass urine in an inappropriate place. This can result in contamination of soft furnishings, carpets, and cause unpleasant odours within the care home. It is essential that your care home has a strict policy of how to safely and effectively manage spillages of blood and body fluids that may be hazardous to health. All spillages should be cleaned up promptly while always wearing a disposable apron and gloves. You should also consider if your residents are using the correct incontinence product, preferably one they have been assessed for, and ensure that it is fitted well. Poorly fitted products can result in leakage, which can also contaminate soft furnishings and flooring.
Let's talk about control of the environment.
Are there any unpleasant odours in your care home? There is a general misconception that care homes are supposed to smell of urine and faeces because it's a care home and that's just the way it is. This is not true, and while you and your care home may not be able to eliminate all the unpleasant odours that result from incontinence, wound care and waste, there is still a lot that can be done to reduce and control unpleasant odours, and it's very important that this is maintained. Any odorous environment is not only unpleasant, but can be hazardous to health. Daily cleaning should take place in your care home, and any spillages or potential hazards to health should be dealt with immediately. Personal hygiene not only helps reduce unwanted odours, it also helps to reduce the bacteria on the skin and therefore helps to protect your residents from developing infections and viruses. It's important to store your residents' incontinence pads in a dry, well-ventilated environment away from direct heat and moisture, such as a cupboard or wardrobe. It's essential to avoid damage to the incontinence product. And it will also help to limit the chances of cross-contamination of the product being touched by another resident or moved by the housekeeper to clean. Incontinence products should be kept away from damp and warm environments. Ideally, incontinence products should be kept in their original packets until ready for use where possible.
Let's talk about management of linen.
How a home manages laundry and clothing will have an impact on infection control in your home. Is wet or contaminated laundry handled safely? How is the laundry being washed and stored? Communal use of fixation pants is not best practice and could also lead to cross-contamination. Residents should have their own labelled underwear and use an individual laundry bag to ensure that fixation pants or nets are not being used communally. Safe management of waste. Your home and clinical waste areas should be well ventilated in order to keep unwanted and unpleasant odours to a minimum. The clinical waste bin should always be fitted with a lid and be able to be opened with a foot pedal, thus avoiding contact with contaminated and soiled products, such as incontinence pads, upon disposal. Double bagging of any potential infected waste should be carried out. Clinical waste policies for changing the bag should be adhered to, ensuring that the bag is not allowed to overflow. Overflowing incontinence clinical waste will not only increase unpleasant odours within your care home, it will also increase the risk of spreading germs and bacteria within your care home. It's also important to pay attention at certain times of the day when the clinical waste bags are removed into the outside waste for collection. The longer these are left in corridors, the more the odour around the home will increase and cause potential risk of infection.
Now, let's summarise what we've learnt.
Hand hygiene remains the cornerstone of infection prevention, and we all need to remember that PPE does not replace the need to carry out safe hand hygiene and decontamination practices. We all need to remember that PPE is part of everyday healthcare, and it is vital that nurses and other health professionals have appropriate training to minimise the risks of cross-contamination between residents and staff. Thank you for attending this module and for using Ontex products in your care home.
You can access further information on Horizon On Demand, which includes fitting guides, literature and more.